and welcome to Attentive Healthcare Solutions webinar. We're excited to share our next-gen add-on solution, ChartGuard, with you today. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with Attentive, I want to share a bit of who we are with you. We specialize specifically in next-gen healthcare. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their next-gen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything next-gen. Okay, so back to ChartGuard. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. And if you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions can be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Attentive's Business Development Manager, and Joel Schultz is the Director of Product Solutions at Attentive, which means that he and his team are the people that actually built this great program. Okay, so Tom, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. I appreciate that. And thank you for taking time out of your day today to learn a little bit more about our ChartGuard solution as well as downtime preparedness and what that's all about. So here's an agenda that we'll go through today. What we'll do is you'll learn about what ChartGuard is. We'll talk about EHR dependencies. You'll learn about why practices buy ChartGuard. You'll learn about how it works and show you the ChartGuard output that gets generated by ChartGuard. And this will be done by Joel Schultz. I'll turn the presentation over to him. And then I'll give you a brief overview of who Attentive is. And then, as Chelsea mentioned, we'll answer any questions that you have at the end of the presentation through the chat box. So what is ChartGuard? Well, ChartGuard is a business continuity solution that addresses and strengthens your downtime preparedness at each of your office locations. And why do practices and health centers buy solutions like ChartGuard? Well, there's two main reasons. One is HIPAA regulations. With regards to HIPAA, there's a clause that states that you have to establish policies and procedures for responding to an emergency or occurrence that damages systems that contain electronic protected health information. And solutions like ChartGuard that address this provide a contingency plan for responding to that. So a emergency mode operation plan or disaster recovery plan, and solutions like ChartGuard help you deal with this HIPAA clause. The second reason is EHR dependencies EHR has become so complex with its technology over the years. We have servers, we have workstations, we have tablets, we have scanners, we have local area networks, we have T1 lines, we have VPNs, we got wireless routers, we got internet connections, we got power systems, cooling systems, all of these components that are now involved in our EHR systems and help it run. And anytime any one of these components can go down. Each one of these components have software that operates behind it, so the software can go down as well. So there's a lot of moving parts, a lot of components that can cause an outage or a system downtime. And when we lose access to our EHR systems, what does that mean to us? Well, that means that we could have a quality of care can be impacted. We could lose productivity. We could lose revenue. And we could have, embarrassment that we're sitting in front of a patient and all of a sudden we lose access to our system. With regards to lost revenue, there are many studies out there that have been done over the years. And in one particular study that was done about 3 or 4 years ago, they determined that a downtime situation with regards to an EHR system can cost a practice about $488 per hour per provider. So it can be quite expensive when a system outage occurs. So when we lose a system, and we have a downtime outage, what options do we have? Well, we could temporarily close the practice or the location. We could go to paper charts, but that's becoming more difficult for us to do now because we're becoming so dependent on our electronic health records. We could go to fully redundant technologies where we are purchasing more technology to add redundancy to our environment. Well, that becomes quite expensive because that, as we're adding more hardware and more software and more data centers and more power systems and cooling systems to address, this pursuit of uptime, obviously our costs increase. And then there are some options that say we can go to hosting, but hosting has its risks as well, meaning that if we have to get out to a hosted site through an internet connection and we lose our internet connection, we have no way of getting to it. Here's some examples of failures, and this is really just a reminder to us as to what causes system failures and downtime outages. I won't go into each one, but I will focus our attention on a couple of them. One, the second bullet where it says sprinkler line failed. Well, we don't have sprinklers in computer rooms, but in this particular case what happened was there was a sprinkler line outside the computer room that had failed, and water started to come into the computer room, and as a result they had to shut down the computer room or the server room, and outside locations had lost connection because of that. In the middle of the screen, in July of 2015, you may remember this occurring a couple years ago, but United Airlines, New York Stock Exchange, the Wall Street Journal, Brookings Institute all had failures on the same day. United Airlines had a network connectivity issue that was caused by a router, and caused United to ground hundreds of flights worldwide for a couple hours. The New York Stock Exchange had a faulty software upgrade that caused them to stop trading on the exchange for nearly 4 hours that day. The Wall Street Journal had a situation where they had a unexpected number of people coming into the website, and they didn't have enough capacity to handle that demand that was coming in, and thus it caused a failure of server connections to occur. And then the Brookings Institute was offline for about an hour due to a content publishing error. The thing about this is that United Airlines, the New York Stock Exchange, and the Wall Street Journal are pretty much built infrastructure-wise to be up 24/7, 365 days a week. So if they can have situations where they lose connections and have downtime situations, systems like we run in our environments can obviously have those types of downtime situations as well. You may remember about 7 or 8 months ago, Amazon, Twitter, Pandora, and Reddit all had downtime situations due to the DIN distributed denial of service cyber attack that occurred that brought down all of these applications. And DIN is one of the largest ISP providers in the world, so they have a large infrastructure in place that is to keep them up all the time. So if they can be hacked by somebody and bring down their system, obviously organizations like ours can be susceptible to things like that too. So the point of this is really to remind us that there are various reasons why systems come down, why we have outages, and to make us aware that these things occur that we have control with, or that we are caused by us that we don't have control over. And I mentioned earlier, about that survey that was done, or that study that was done of $488. Well, that means at a 10 provider practice that's down for 4 hours, it can cost $19,520. So it can be quite expensive when you start putting the numbers to the number of providers and the number of hours that you could potentially be out. So as you're thinking about downtime situations and you're thinking about solutions for downtime situations, there are some questions that you should be asking yourself when you're going through this process. One of the questions is, do I pursue uptime or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? Do I go to fully redundant technologies and pursue the uptime perspective? As I mentioned, that could be quite costly. Or do I realize that I may have a downtime situation and I just need to have a solution in place that gets me by until I can get NextGen back online? Am I going to be reactive or proactive in my clinic's preparedness for a downtime situation? Am I going to be reactive, meaning that I've had an outage and now I have to do something about it? Or am I going to be proactive, meaning I probably am going to have an outage at some time in the future. I haven't had one yet, but I may have one. So I'm going to be proactive and be prepared for that situation occurring. Another question to ask ourselves is, what type of an impact does it have on the practice or the clinic when you have a NextGen downtime incident? Are those impacts, quality of care? Are those impacts lost productivity, and what does that mean to us? Are those impacts lost revenue, patient satisfaction? So what are those impacts that we have as an organization if we lose access to NextGen? And then the subsequent question to that is, what's the significance of that impact going to be to our clinic if we have an outage? So is it going to, if we have one that lasts for 15 minutes, what kind of an impact is that to us, both financially, patient satisfaction-wise, our overall operations? If we have an impact of an hour, what does that mean to us? If we have an impact for 2 hours or 3 hours, what does that mean to us as an organization? So ask yourself these questions as you're going through this process and trying to determine what to do with the downtime situation and implement a solution for it. And really the bottom line question is, it isn't whether your clinic's going to lose connectivity, it's a question of how to minimize the loss and how to minimize the disruption when it does happen. Going back to those examples that I talked about previously with regards to United Airlines and the New York Stock Exchange and the Wall Street Journal, they all had impacts, and they're all built for 24/7, 365-day-a-year uptime. So, if it can happen to them, it can happen to us, and we should be prepared to do that. And what does that disruption mean to us? How can we minimize that loss and that disruption? So the ChartGuard solution, as I mentioned earlier, is an affordable business continuity solution that ensures that your practice is productive, profitable, and secure during an EHR downtime. It gives us complete availability offline of the clinical record, and we do that in PDF format so it can be easily accessed and easily read. Now I'm going to turn it over to Joe, and he's going to go through how ChartGuard works.
Thanks, Tom, and thank you everyone for taking time out of your day to join us. We really appreciate it, and hopefully we can show you a great solution here for handling your downtime. So as Tom mentioned, there's a variety of reasons why systems fail. And one of the design goals of ChartGuard early on was to be able to work around those solutions, to be able to have not just server failures, but network failures, and still be able to get to your clinical data. In fact, the initial clients we were working on ChartGuard with lived in areas of the country that were subject to storms in the summer. So outages were a fact of life, especially network outages where the wires are out, dangling on poles and stuff, somewhere along the path. So we worked with them to create ChartGuard, and since then we've continued to enhance and grow it. Now, how does ChartGuard do what it does? Well, the way ChartGuard works is we've put all the intelligence on the back end to go through your NextGen database, look at upcoming appointments, and create PDF versions of the patient chart. If you think of it as maybe creating a paper version of the existing electronic chart and transporting it out to each site, in a nutshell, that's what ChartGuard does. So it'll look at your upcoming appointments. It'll generate a set amount of history for each patient. So you don't have to generate 10 years worth of history if the patient's been coming to you for 10 years. You just generate what you pick and deem appropriate for a downtime situation. So it'll generate those charts, and then it'll copy them off to a designated computer, a designated network share at each site. So that way, if the network goes down, those charts for those people already scheduled to come in are out there at the site in advance. In fact, we normally do several days worth of appointments so that we can capture as much of the clinical information for the upcoming days in case either A, your outage lasts longer than you thought it was going to, or B, that the outage just happened maybe during the ChartGuard run. So that way you still have the information from the prior day's run out there, even if the new information didn't get copied. So ChartGuard sits close to your database server, and it works whether you're hosted or you have the servers in-house. It goes through the database, it creates these PDF files, and as Tom mentioned, why PDF files? Because PDF files can be easily read on just about any computing device. So we wanted to make something that during your outage had a low technology footprint. It didn't need a ton of technology. It wasn't just another EHR, right, backing up your current EHR that wasn't working for a variety of reasons. So we wanted something that was simple to use, didn't require another database server, another set of front ends, so on and so forth. We determined with our clients that the PDF was kind of the best way to go for this situation, because you can use your existing hardware, you can use tablets and such, you could potentially connect a smartphone to your local network and pull it up on there. So there's a variety of ways, and then in the worst case, you could even dump it to paper really easily. So if you had that PC at each location where the charts land and you had a printer directly attached to it, as the patients come in, you could dump that chart to paper, put it in the manila folder, and it would be just like we were several years ago, where you have your paper chart and you take it down to the exam room with the patient. So that's the brilliance behind ChartGuard. It's not a cloud-based solution that only works if your internet is still up. It's a solution that works even if you can't get outside your four walls. Okay, your network's down, your internet's down, you can't get to anything, you still have these charts available to you. So out of the box in ChartGuard, what you're going to get is each site is going to get an appointment listing because it's useful to know who's expected to come in that day. And then in the chart itself, you're going to get a patient data sheet, which is just kind of a summary of the demographics and their insurances and such, and we'll show you these in just a moment. We're going to pull your module data. So that's going to be in the chart as different sections. As you can see here, we're going to pull your EHR documents. And again, a set amount of those. We'll work with you to determine how many of those you want to pull in, what depth of history you'd like. And also you can pull in ICS content. So we're trying to give you a full picture of the patient's clinical history during that downtime by pulling this information out. So it's not just data, it's also documents generated and items that have been scanned in to ICS. So let's go ahead and take a look at the chart. So I'm going to pop out of here. And hey, Tom, can you pull up the chart?
Yep.
Perfect. I'm not seeing your taskbar, so. Oh. Okay, great. Yep. Okay, great. All right, so this is the demographic sheet. Again, it's just a summary of the patient, allows you to confirm who they are, right? Gives you their contact information, their insurance information. If you were doing this via paper, you just go ahead and, flip through the various pages. We have the module data we were talking about for allergies, medications, labs and orders, great things like that that are available to the clinician. If you are using it electronically, though, you don't necessarily have to scroll through. You can go ahead and bring up the bookmarks, and that'll allow you to jump to the different sections of the chart to review information. In fact, in our sample here, we have a master IM available that we pulled in. We have some images that we pulled in. And then optionally, you could go ahead and have an account summary so that you are aware if they owed you any money at the time of the visit too. So it's giving you all this information, again, in a low technology footprint that makes it easy. So when the provider walks in to see the patient, it's that embarrassing situation. Maybe the patient was there last week, right? And to them, they were just at the doctor. Why don't you remember me? But for the provider, it's like, you know, I've seen 200 patients since you, so I may not remember who you are. Well, you know, in this case, they have the information available to them. They can walk in. So it's not just a financial issue of downtime, but it's a credibility / embarrassment issue of not having their clinical information. Okay, so as mentioned, this can be used electronically, read on multiple devices, or printed to paper, and then you just kind of page through it. So it's your information in your NextGen database. As part of the setup, we'll work with you on how much data you want to incorporate in the chart. And normally that ends up being a balancing between how much you need, what's the minimum, what's your kind of wish list case, and how fast does ChartGuard run on your equipment based on your network and database and other factors that go into that. Hey Tom, can you bring me back to the slides? And here's the appointment listing real briefly, just to let you know who's coming in. Okay, great, thank you. ChartGuard does allow for customization. So we know every next-gen installation, especially EHR, is a little bit different because of the nature of the EHR and the ability to add on to it and to make your own templates. So we've built ChartGuard around that concept. It works fine with KBM. If you have some customization, we can work with you on matching that customization. If you're generating documents from those custom templates that you have, then we can go ahead and simply just pick up those documents. But if there's data fields that you're not using in documents that you want to pull in the chart, we can go ahead and work with you on that. So we've kind of built ChartGuard to be dynamic and flexible, which again in our next-gen world is more of a requirement than an option. Okay, Tom, I'll go ahead and turn it back to you to cover the rest.
Okay, thank you, Joe. So as Joe mentioned, ChartGuard is there when you have a downtime situation and allows the practice to continue on seeing their patients. This is a snippet of an email that we received from one of our clients who had purchased ChartGuard in about a year ago, and in December of last year they had an outage, and they just sent us an email saying that they had an outage on December 9th and lost access to two of their biggest clinics, and they had ChartGuard to go to, so they didn't have to close any clinics or turn away any patients, and that the providers at those particular locations were quite pleased with how ChartGuard had worked, providing them the information so they can continue to see their patients. There are a couple of versions of ChartGuard that we have developed over the years from that initial release that we made. We have ChartGuard OnDemand that allows you to create a patient chart on request. So if somebody comes into your office and says, I would like to have my patient chart created for me, you can put that into ChartGuard, and that request can be fulfilled and printed off within 15 minutes or so. And then we have ChartGuard Archiver, which can be used for long-term storage of charts. The ChartGuard OnDemand can also be used for audit requests. So if you have insurance auditors that come in and want to do an audit, or we have lawyers that call and say they need to have a certain amount of patient history provided to them, you can do that through ChartGuard OnDemand as well. A little bit about attentive. We were founded in 2003, and our mission is to create additional value for your next-gen investment, as Chelsea had mentioned in the beginning of our webinar. And we know that when you purchased NextGen, it was a major purchase, and probably over the few years, your investment's grown because of upgrades and enhancements, as well as probably having to buy additional hardware. And we want to work with you to get as much value out of that as possible. Our passion is to work with our clients to help improve patient care, work with our clients to help enhance the patient experience, and work with our clients to maintain a financially healthy practice. We have 19 years of experience with NextGen and 70 employees, most of which are consultants that travel from practice to practice, location, health center to health center, working with the individual organizations to improve workflows, improve business processes, improve reporting, use the system to help improve decision making as well. If you take the 2003 to 19 years, they do not add up, and the reason for that is attentive started out as the IT department for a medical organization. And back in the late 90s and early 2000s, when the business mantra was focus on what you do best and outsource the rest, the leaders of the medical organization were going to outsource the IT group. And the leaders of the IT group said, well, if you're going to do that, what we'd like to do is form our own company and provide services back to you. So they agreed to do that, and from that point forward, we've worked with over 350 to 400 clients that use NextGen, and we've become a strategic partner with NextGen as well. We have five service lines, and through these 5 service lines, we can do implementations of NextGen. As I mentioned, we have a consultant that work with clients to do process improvements, workflow improvements. We have a group of developers that can enhance templates. We also have a group that can do upgrades to NextGen and provide support as well. We have a group of technology people that can provide IT managed services, where we can manage your infrastructure, your desktops, your laptops, your printers, your local area networks, your wide area networks. And then we also have our own data center, so we host clients out of that data center as well. And then we have a group of developers that work with Joe's team that develop our productivity tools, of which ChartGuard's one, but then we also have Refund Manager that streamlines and automates the credit balance handling and refund check processing that occurs within an organization. We developed for Phreesia. Phreesia helps automate the patient intake part where patients come in, they can enter their information, demographic information, into a Phreesia tablet. We've created an interface that allows them to also update their clinical information as well. And then we've worked with a company called Doctors Link to integrate NextGen to Transworld in order to lower the cost of collections. So just some of our other productivity tools that we have. So at this time, we will take any questions that you might have. You can enter the questions down into the questions area, and we'll answer any questions that you have.
Great, thank you, Tom, and thank you, Joe, as well. I know that was a lot of information, and we'd be happy to answer any questions or go through it, anything again. So again, questions can be typed in the questions area of the webinar control panel. It looks like we only have a couple so far, so if you have a question, feel free to ask it. I'm sure we're going to have time to answer. Otherwise, if you think about it after the fact, both Tom and Joe's information are up on the screen. Don't hesitate to reach out to them. You can reach out to me. I'm the one who sends all the invitations to these things. Any way you can get a hold of us, we'd be happy to answer your questions. So first question, is ChartGuard in the cloud?
This is Joe. I'll go ahead and jump in on that one. ChartGuard runs wherever your NextGen database is. So if your NextGen database is hosted, it can run in the data center where that is. Some people may call that in the cloud. But when you access your charts, an important differentiation is the charts are not stored in the cloud. The charts are stored on-premise. So that way, if the network is down, you have access to those charts as, again, one PDF file per patient. so that you can easily get to that information when you can't get to the network. That's a huge differentiator of ChartGuard.
Great, thank you, Joe. Next question. We have over 147 providers. Would this still work for that?
Yes, it does. ChartGuard works in small NextGen sites and large multi-location, multi-practice NextGen sites. It's been designed to scale up, so we can run with multiple ChartGuard, what we call engines, that produce the PDFs. So if you do have a large site with many locations and or many practices and many providers and a large patient volume, we can go ahead and accommodate that with ChartGuard in addition to the smaller sites.
Great, thank you. Now, it looks like this may be our last question. We'll hang on just in case anybody's in the middle of typing. Can we use this to give patients a printed copy of their medical record?
You can use a variation of ChartGuard called ChartGuard OnDemand, and that will give you the ability to extract charts either one at a time or in sets of populations at a time, and give the patients their complete medical history if they were going to go see a specialist or they're moving out of state and going to get a new provider. So it gives them something that's nice and easily readable that they can take with them.
Great, thank you, Joe. Looks like another question came in. How is it priced for the 3 solutions?
I'll take that question. So ChartGuard has, we have 3 license level, a standard license, a professional license, and a enterprise license. Standard license is used for, smaller practices with 1 to 2 to 3 locations, and then professional license is used for larger practices with many locations, and then the enterprise license is used for much larger practices that have many locations and could have several practices as well. The components to the pricing of ChartGuard is there's 3 components. There is a license fee, which is a one-time fee. There is a installation, training, and setup fee, which is a one-time fee. And then the last component is your annual maintenance fee, which is your only recurring fee.
Great. Thank you, Tom. And thank you, everybody, for attending today. I hope that you have a great rest of your week and a happy 4th of July. And if you have any questions, again, please don't hesitate to reach out to us, and we look forward to talking with you more in the future. Thank you, everyone.
Thank you.
Thank you.